So in this lecture we are going to talk about the different glycogen storage diseases. So at least 15 types of glycogen storage diseases have been identified, all resulting in the abnormal glycogen metabolism and accumulation of the glycogen within the cell. The periodic SIF stains identify the glycogen, and it is useful in identifying those diseases. So the various glycogen storage disease type 1, type 2, type 3, type 4, type 5, type 6 and type 7 glycogen storage diseases. Today we will talk about this. So first disease is von Gierke disease, which is type 1 glycogen storage disease. So the deficient enzyme in this disease is glucose 6 phosphate. So here what happens, the glucose 6 phosphatase enzyme is deficient in this disease, and glucose 6 phosphate cannot be converted into glucose. So the findings will be severe fasting hypoglycemia, the liver doesn't regulate the blood glucose, and if we see in the liver and kidneys, there will be the increased glycogen storage in the liver and kidneys, and there will be increased blood lactase, increased triglyceride and increased uric acids. There will be the hepatomegaly and there will be the renomegaly. So in this von Gierke's type 1 glycogen storage disease, frequent oral glucose or cornstarch intake will decrease the symptom, and we should avoid the fructose and galactose. So now let us talk about the type 2 glycogen storage disease, that is Pompeii disease. In Pompeii disease, the lysosomal acid alpha-1 glucosidase, which is acid maltase, with the alpha-1C glucosidase activity is deficient. So here there will be the cardiomegaly, hypertrophic cardiomyopathy, hypotonia, there will be the exercise tolerance, and there will be the early death due to these findings. Now let us talk about the type 3 glycogen storage disease, that is Cori disease. So in this type 3 glycogen storage disease, in the Cori disease, there will be the deficiency of debranching enzymes. The debranching enzymes will be deficient. Alpha-1,6 glucosidase and 4-alpha-D gluconotransferase will be deficient in this disease. The type 3 Cori disease is similar to type 1 glycogen storage disease, but it is milder. There will be the normal lactate and can lead to cardiomegaly. In what happened in the cytosol is that, what is the finding is that there will be the limit dextrin-like structure accumulated in the cytosol. So in the Cori's disease, the gluconeogenesis is intact. Now let us talk about the type 4 glycogen storage disease, Anderson disease. There will be the deficiency of the glucosyl 4,6 transferase enzyme. This is the branching enzyme. What are the findings in the Anderson disease? In the Anderson disease, there will be the cirrhosis of the liver and impairment in the liver function. Most of the tissue are affected. In this Anderson disease is the rare disease, and glycogen has the few branches due to the deficiency of the branching enzyme glucosyl 4,6 transferase. Now let us talk about the type 5 glycogen storage disease, that is MC-Adel disease. Here what happens, there will be the decreased amount of myophosphorylase. The myophosphorylase is deficient in the MC-Adel disease. The skeletal muscle glycogen, that is myophosphorylase, is deficient, and it is characterized by the flat venous lactate curve with normal rise in ammonia levels during the exercise, and the finding will be increased glycogen in muscles. There will be the painful muscle cramps, there will be the myoglobinuria with strenuous exercise, there will be the arrhythmia due to the abnormalities in the electrolyte, and there is the second wind phenomena. Second wind phenomena is noted during the exercise due to increased muscular blood flow. So now let us talk about the Hirsch disease. The Hirsch disease is the type 6 glycogen storage disease. The deficient enzyme is the liver glycogen phosphorylase, and the findings is enlarged liver and mild hypoglycemia and ketosis. Here the liver can't perform the liver can't form the glucose in the Hirsch disease. Now let us talk about the Thyroid disease. The thyroid disease is the type 7 glycogen storage disease. There will be the deficient of the enzyme phosphofructokinase, and after the exercise there will be the severe muscle cramp, there will be the hemolysis, and the blood lactate level are not elevated in thyroid disease. The main organs involved are skeletal muscles, and the RBC, red blood cells, are affected in the thyroid disease. So we discussed about the various glycogen storage disease. Again, I am going to enlist those glycogen storage diseases like type 1 von Gryke disease, type 2 Pompeii disease, type 3 Coris disease, type 4 Anderson disease, type 6 Anseri-Adler disease, type 6 Huss disease, type 7 Thyroid disease. So these are the 7 glycogen storage diseases that you should know. And also type 1, type 2, type 3 and type 5 diseases are the autosomal recessive. So this much for today. I hope you understood this lecture video on the glycogen storage diseases. Thank you.